Hello everyone, welcome back to my YouTube channel Speedy Dentistry. Today we'll be learning about hemangioma, that is basically the blood vessels are affected, and oma is for growth. So hemangioma is a benign tumor of blood vessels comprising of arterioles. Along with that, endothelial cells are also affected, and the growth is definitely proliferative and hyperplastic in nature. Alright, for the clinical presentation, this hemangioma is seen in initial few weeks of life only. For the age, it can be present at time of birth or within few weeks to days of life. For the appearance, it is reddish in appearance. Now comes the depth. So basically it affects the skin and submucosa, more commonly of the middle third of face. And type we can see from the age only that it can be infantile or congenital in nature. Third points are behavior. So behavior of hemangioma is basically slow growing since it is a benign tumor. And for the functional problem, for slow growing, that is like a snail. For the functional problem, if it is near the eye, it can lead to vision loss or impairment. For the near the ear, it can lead to hearing problems and airway issues or problem while the swallowing can be seen, depending upon the region the hemangioma is present. For the 3 stages in the life cycle of hemangioma, the first one is proliferative, then second one is involuting, and third is involuted. So basically proliferating is increase in growth, which is seen at 0 to 1 years of age. Involuting is for 1 to 5 years of age, and involuted, that is the growth stopped or has decreased, which is seen at more than 5 years of age. So basically the growth increases for 0 to 1 years, proliferative phase, involuting for 1 to 5 years, and involuted for more than 5 years of age. Now comes the pathogenesis. So 2 theories have been given, that is the placental tissues which are present in fetus at the time of gestation leads to hemangioma. Also, the stem cells or the endothelial progenitor cells which give rise to hemangioma are found in circulation of patients affected by the disease. For the classification, it can be superficial, deep, or compound. For the superficial, the capillary, it is also known as capillary hemangioma or strawberry hemangioma. Deep is for the cavernous hemangioma, and compound is capillary along with cavernous hemangioma. Next comes for the radiological perspective. To find the radiological perspective of disease, we can go ahead with simple USG, that is the ultrasound, which is highly sensitive for the detection of hemangioma. Also, we can go for color Doppler ultrasound, which can help us detect high flow blood lesions, that is the hemangioma. Next option, we are having CT with contrast. So with CT, calcifications can be seen, and also cross-sectional details of the hemangioma or the affected site can be seen more properly. Next option we are having is digital subtraction angiography. What we'll do, we'll take angiographs and we'll digitally subtract both of them. So this is basically done for patients who are on endovascular treatment. So we do one angiogram after the treatment, one before, and then we digitally subtract to see the decrease or effect on the lesion site. Next option we are having is MRI, which is most preferred and accepted method. And in this we use T2 weight fat suppressed MRI to discriminate the hemangioma. Other options that of MRI are MRI angiogram and also multiplanar that is in multiple planes, dynamic, contrast enhance, MRI. So for the radiological perspective, we can use USG and color Doppler USG. Third one is CT with contrast. Fourth is digital subtraction angiography. Fifth one is plain MRI or MRI angiography we can go ahead with. And seventh is multiplanar dynamic contrast enhanced MRI. For the management part of any disease, we know it can be medical, interventional or surgical. For medical management, we go for beta blockers or steroids. In beta blockers, propranolol is given commonly, and this leads to vasoconstriction. So, flow of the lesion will be decreased. For interventional perspective, we can go ahead with minimally invasive sclerotherapy, or we can go for systemic sclerotherapy. Surgery, we have seen the course of disease that is proliferate, involute, and then involuted. So the surgery is commonly not needed, but if the lesion is very large in size, or it is growing, or it is affecting any important structure, then we go ahead with the surgery. Also, embolization can be done with or without the surgical excision or debulking, and for this we use ethanol, cyanoacrylate, and polyvinyl. Next comes when is active intervention required. Before that, so for the normal course, we wait and observe for hemangioma to subside. If not, or commonly it subsides in 85% of patients or children before 5 years of age. If any malignancy we are suspecting, so we go ahead for biopsy along with GLUT1 immunostaining. And when we require the active intervention, that is surgery, when the size is very large and resulting in facial asymmetry, when there is any systemic complication or changes like increased cardiac output and affecting the failure chances of heart. Next comes the important structures are involved like airway or eyes or ears. Then we go for active surgical intervention, and fourth one is recurrence, or there is any persisting ulceration. For the surgical management, there are 5 types, or depending upon the affected layer of skin or the tissue. So basically, first one is superficial. For the superficial lesion, we'll go ahead with excision and recreate it with local or regional flap. While for the submucosal, we go for complete excision and flap via the preauricular excision is taken. For venous malformation, we remove the entire gland along with the lesion via Weber-Ferguson incision. For intraosseous, we remove the intraosseous is bone, so we remove the entire or excise the entire bone and then reconstruct it with reconstruction plate or bone graft. For the deep visceral spaces, complete removal of the lesion is performed. And for high flow lesions at the end, we perform corset suturing to decrease the corset suturing or crisscross suturing to decrease the flow of the lesion. For the complications, we know that it is hemangioma, so excessive bleeding can be seen. Ulceration we have studied previously also. For infection, it can be viral or bacterial infection, or it can be also super infection. Dyspnea, difficulty in breathing, and dysphagia, difficulty in eating, can be seen due to presence of hemangioma at important structures, and necrosis of skin can be seen. Thank you for listening.